trapezius. This muscle here behind, this is called as the trapezius muscle, large muscle here. Okay, this is called as trapezius. So the anterior border or superior border of the trapezius, this is the posterior boundary. So these are the boundaries for the triangle, for the whole of the neck, side of neck. Okay, superiorly we have the base of the mandible, line drawn vertically from the angle of mandible to the mastoid process, then superior line. Below is the clavicle here. Okay. Then in the front, midline. Posteriorly we have the anterior border of the trapezius. Okay, this is the whole of the neck. Okay, now it is divided into two triangles. One is anterior triangle, the posterior triangle. How? By a muscle. Which is that muscle? Sternocleidomastoid muscle. Why it is called as sternocleidomastoid muscle? Yeah. So it takes origin from the sternum. What do you mean by sternum? This bone here, this one. This is called as sternum. Okay, this is the whole sternum. It has three parts. If you can see here, this upper part, this is called as the manibrum sterni. Okay, this is called as the body of the sternum, and this is called as the xiphoid process. Somebody was asking xiphoid process. So this is the xiphoid process. So three parts of the same bone. So this whole thing is the sternum. This is called as manibrum sterni. This is called as the body of the sternum, and this is called as the xiphoid process. Now we are concerned with only this part. Okay. So the muscle, this muscle, sternocleidomastoid muscle, take origin from, the name itself indicates sterno. So sternum, this is the sternum, whole thing. So it takes origin from here, sternum. Sternocleido, cleido means clavicle. So it takes origin from two heads. Okay, mastoid, where is mastoid? This is the mastoid process. Okay, so take origin from here to sternocleidomastoid process. So the name itself indicates the origin and insertion of this muscle. Okay, what is the nerve supply for that muscle? Accessory nerve. What is that nerve? Nerve? 11 cranial nerve. There are 12 cranial nerves. Cranial nerves means the nerves coming from the brain. Okay, brain or the brain stem. They are called as the cranial nerves. They are coming from the brain or the brain stem. Okay, so these are called as cranial nerves. The nerves which are coming from the spinal cord, they are called as spinal nerves. Okay, two types of nerves are there. Cranial nerves which are coming from the brain or the brain stem. The nerves which are coming from the spinal cord, they are called as spinal nerves. So the nerves coming from the brain or brain stem, that is the cranial nerves, are 12 pairs. To be more specific, 12 pairs, because 12 on this side, 12 on the other side. Okay, so 12 pairs. Among these, they are numbered from 1 to 12. Okay, so this nerve which is supplying this muscle, sternocleidomastoid muscle, this is the 11th cranial nerve which is supplying. Okay, so the name of that nerve is the accessory nerve. Okay, accessory nerve. Okay, so this is the nerve supply. What is the action of this muscle? One side. So see, the origin of this muscle is here. What do you mean by origin? The part which is fixed when the muscle contracts, the part which is fixed is called as origin. The part which moves is called as the insertion. So this is called as origin, so this is fixed, it doesn't move. So when this muscle contracts, what happens? It pulls the head towards the other side. Okay. So imagine here, so if this muscle contracts, so this is the origin, so this is stable. So this has to move. Okay. So when it contracts, this muscle becomes contraction becomes smaller. That time this head will be pushed. Okay. So it rotates. When only one muscle contracts, so it will rotate on the other side. If this muscle contracts, it will just move on the other side. Okay. When both the muscles contract, then they both the muscles contract, then the head moves. Except the neck. Okay. Both except the neck, especially when you are getting up from the bed. So when you try to get up, first everything comes upside, or when you pull yourself, so first the neck will come. Okay, so you'll do the flexion of the neck, then the whole body will come. So at that time, this is very important. This muscle contract, at that time it helps in the flexion of the neck. Okay, this is the origin of this muscle, insertion of the muscle, nerve supply and action. These are the 4 things you should remember. There are other things, but you should remember at least these 4 things. Okay, so this is about the sternocleidomastoid muscle. So this muscle will divide this whole of the neck into two triangles. One is the anterior triangle, the second is the posterior triangle. So what are the boundaries for the, now we have to see the boundaries for the anterior triangle and posterior. So what are the boundaries for the anterior triangle?
Anterior border of posterior triangle.
No. What are the boundaries for the anterior triangle? So the anterior triangle, the anteriorly the same midline structures. What are the midline structures? Which are the midline structures? You should know the midline structures from above downwards. Okay, symphysis menti before, yeah, median raphe. The median means at the center. Medial means towards the center. So you should know some terms in anatomy. Okay, whenever we see median, median means center of the body. Whatever is in the center, that is called as median. When it is towards the medial side, that is called as medial. There is just some spelling difference, that's all. Median when it is at the center, medial when it is towards the center, not in the center but towards the center. So this is the median thing, okay, median line, okay. So this is the symphysis menti above, then we have a median raphe connective tissue here, okay, extending from the symphysis menti up to the hyoid bone. This is called as the hyoid bone. Here if you see, here we have the hyoid bone here. This bone here which you see is called as the hyoid bone, okay. So symphysis menti above, then we have the median raphe, then the hyoid bone, then what next?
Thyroid.
Yeah.
Thyroid ligament.
Thyroid ligament. Okay, there will be a cartilage. This cartilage which is moving whenever you swallow, which goes up and down, that cartilage is called as thyroid cartilage. Okay. In case of male, it is very prominent, so it is called as Adam's apple. Okay. So that thyroid cartilage will be there. Why the cartilage is not there here? Cartilage will be dissolved. Okay. Only bones will remain whenever all the muscles are removed. Okay. So the cartilage will be here. So the between this thyroid cartilage and the hyoid bone, there is a membrane called as thyroid membrane. Okay. Between these two, there is a membrane. So the third part will be thyroid membrane. Then the fourth will be the thyroid cartilage. The angle of the two, there are two parts of this thyroid cartilage, two wings of the cartilage that join together and they form the angle. Yeah. The prominence.
Of a thyroid.
Yeah. So that is called as the angle of the thyroid will be here. Then below that, there is one more cartilage called as cricoid cartilage. Cricoid cartilage. Between this cricoid and the thyroid cartilage, there is a membrane that is called as cricothyroid membrane. Start from below and go upward. Cricothyroid membrane. Okay. Then the cricoid cartilage. Then below that will be the thyroid gland, and below that will be the trachea. Whatever you feel here, just above this mammiferarum sternum. Whenever you push your finger and feel, that is nothing but the trachea. Whenever you are speaking, at that time it shakes. Just touch it and try to speak, at that time you will feel. There is movement of the voice production will be felt there. Okay. Okay. So these are the midline structures. From above downwards, once again I repeat, there is the symphysis menti, median raphe, hyoid bone, then the thyroid membrane, then the thyroid cartilage, then below that will be the cricothyroid membrane, then cricoid cartilage, then the thyroid gland, and below that will be the trachea. All these are the midline structures which are there. Whenever you remove the skin and the superficial fascia, deep fascia, whatever you come across will be these structures. Okay. So for the boundaries for the anterior triangle will be in the front, it will be the median structures or the midline. Okay. So the midline. Then the superior boundary is, or the base of this triangle will be base of the mandible, as well as the line drawn from here, from the angle of mandible up to the mastoid process. Okay. Then the posterior boundary will be the anterior border of the sternocleidomastoid muscle. Okay. So this forms an angle, triangle. Okay. This is the triangle. So this is called as anterior triangle with the apex directed downwards and the base is above. Okay. So it is a reverse triangle. Apex down, base above. So these are the boundaries. Okay. So anteriorly we have the midline. Superiorly, that is the base of the mandible as well as the line drawn. Then posterior we have the anterior border of the sternocleidomastoid. So these are the boundaries of the anterior triangle. Posterior triangle, what are the boundaries? Anteriorly we have the posterior border of the sternocleidomastoid. So here it is the anterior border, this is the posterior border. Okay, posterior border of the sternocleidomastoid. Behind posteriorly we have the
Anterior border of trapezius.
anterior border of the trapezius. Down base by clavicle. Good. So these are the three boundaries. Posterior triangle. Anteriorly we have the posterior border of the sternocleidomastoid. Posteriorly we have the anterior border of the trapezius, and the base is by the clavicle. So these boundaries you should know. Then again there are two triangles here, above and below. So how they are divided? Into two triangles, occipital as well as the subclavian triangle. How they are divided into two? By a muscle called as omohyoid. Can you see this muscle here? There is one muscle here called as omohyoid. This is the inferior belly of the omohyoid. The superior belly is here. Okay, there are two bellies for this muscle. One is superior belly and the inferior belly. So inferior belly of omohyoid divides this triangle into two triangles. That is, superiorly we have the larger triangle called as occipital. Below we have the subclavian triangle. What are the content? You should know the boundaries of the triangles and the contents of the triangle. So what are the important content? At least you should know one or two. Okay, what are the contents of this larger triangle posteriorly? That is the occipital triangle. What are the contents? Which is the nerve supplying this muscle? Sternocleidomastoid. Which is the nerve? I just know, I told you. Accessory nerve, 11th cranial nerve. So that nerve will be here in this triangle. So it will come through this triangle and supply this muscle. So the main content of this triangle is the accessory nerve. Okay, remember this part. Okay. Then inferiorly we have, this is called as the subclavian triangle, or it is also called as the supraclavicular triangle, because it is above the clavicle, so it is called as supra. Supra means above clavicle. So supraclavicular triangle. Okay. So what are the contents of this triangle? Supraclavicular, or it is also called as subclavian. Why it is called as subclavian? Because the subclavian artery and the subclavian vein are passing through this. Okay, subclavian artery and subclavian vein are in this triangle, so that's why it is called as subclavian triangle. Okay, so these are two triangles posteriorly. Anteriorly, you should know the boundaries of all these triangles in particular. Okay, here anteriorly we have again four triangles. One is called as the front, that is called as muscular triangle. Behind we have the carotid triangle. Above we have the digastric triangle, and in the front we have one triangle that is called as submental triangle. Okay, so anteriorly we have the muscular triangle. So what are the contents of the muscular triangle? The name itself indicates muscles. Yeah, muscular. It is called a muscular triangle, so it will have muscles. Which are the muscles? Sternohyoid and sternothyroid. These are the muscles here. Okay, we'll talk about that muscles later. Sternohyoid and sternothyroid are the muscles which are there. Deep inside, if you go, then there will be some important structures which are there deep inside. Larynx is there. Esophagus. Pharynx. Okay, all these structures are there, and as well as the thyroid gland, because you are approaching the thyroid gland. So very important content, because sometimes the thyroid gland will enlarge. That is called as, okay, that we'll study later. There are different conditions. Okay, so the thyroid gland will be there. Then we have the larynx. Then we have the esophagus, trachea. All the structures are here. Okay. Posteriorly, we have one triangle called as carotid triangle. So the name itself indicates what? The content is very important artery, common carotid artery, very important artery, which is supplying the whole of the head and neck as well as the brain. So very important artery. If you want to trace this artery, it is there in the carotid triangle. Okay. So this common carotid artery will divide into two. One is called as external carotid. The second is called as the internal carotid. External carotid will supply the whole of the neck as well as the face. Internal carotid will go directly into the brain and supply the brain inside. Okay. So the internal carotid has no branches here. No branches. Internal carotid